incompetence.
Rocco, let's make sure we're clear on something. Let's stipulate that this is not a vaccine. I mean, we need to be really clear. We're using the term vaccine to sneak this thing under public health exemptions. This is not a vaccine. This is a mRNA packaged in a fat envelope that is delivered to a cell. It is a medical device designed to stimulate the human cell into becoming a pathogen creator. It is not a vaccine. Vaccines actually are a legally defined term, and they're a legally defined term under public health law. They're a legally defined term under CDC and FDA standards, and a vaccine specifically has to stimulate both an immunity within the person receiving it, but it also has to disrupt transmission. And that is not what this is. They have been abundantly clear in saying that the mRNA strand that is going into the cell is not to stop transmission. It is a treatment. But if it was discussed as a treatment, it would not get the sympathetic ear of public health authorities, because then people would say, well, what other treatments are there? The use of the term vaccine is unconscionable for both the legal definition term of it, but also because it actually is the sucker punch to open and free discourse. Because by saying vaccine, you dump it into a thing where you could be anti or pro the therapy. But if you actually talked about it as a therapy, remember, and people forget this, Moderna was started as a chemotherapy company for cancer, not a vaccine manufacturer for SARS. If we said we're going to give people prophylactic chemotherapy for the cancer they don't have, you'd be laughed out of a room because it's a stupid idea. That's exactly what this is. This is a mechanical device in the form of a very small packet of technology that is being inserted into the human system to activate the cell to become a pathogen manufacturing site. And I refuse to stipulate in any conversations that this is in fact a vaccine issue. The only reason why the term is being used is to abuse the 1905 Jacobson case that has been misrepresented since it was written. And if we were honest with this, we would actually call it what it is. It is a chemical pathogen device that is actually meant to unleash a chemical pathogen production action within a cell. It is a medical device, not a drug, because it meets the CDRH definition of a device. It is not a living system. It is not a biologic system. It is a physical technology. It happens to just come in the size of a molecular package. So we need to be really clear on making sure we don't fall for their game, because their game is, if we talk about it as a vaccine, then we're going to get into a vaccine conversation. But this is not, by their own admission, a vaccine.
So,
And
Judy,
as a result, it must be clear to everyone listening that we will not fall for this failed definition, just like we won't fall for their industrial chemical definition of health, because both of them are functionally flawed and are an explicit violation of the legal construct that is being exploited.
so Judy, as a scientist,